Good day and welcome to the unit that you have elected, Emergency Image Interpretation 1. My name is Imelda Williams. I am a senior lecturer in the Department of Medical Imaging, and I will be the unit convener as well as the chief examiner for this unit. I have a keen interest in image interpretation, in particular in planed radiographs.
Hello, my name is Crystal Lee and I'm a lecturer in the Department of Medical Imaging here at Monash University. I have a keen interest in CT, in image interpretation, but also in understanding how the CT image is constructed and how that helps our learning in the area of CT. These are our academic contact details. So you'll see that for both Imelda and myself, Crystal, we have our email addresses. Please email us in the first instance as the best way to contact us, and we'll do our best to respond to you as soon as we can.
You will find the unit objectives in the unit guide. The two themes that we're covering in this unit is related to plain radiographic images as well as CT. And we hope that at the end of this unit you will be able to determine how sensitive you are in identifying abnormalities, and then also your specificity, which is identifying the normals as well as the accuracy in relation to the images that you are interpreting. For plain radiographs, the focus will be on long bones, girdles, the cervical spine and the chest, and we hope that you will have a logical method when you view those images so that you do not miss essential pathology. And we will also guide you in generating informed opinions on the plain radiographs.
In terms of CT, the first key objective is to be able to understand the different key ways a CT image is produced and how this impacts what sort of pathology and anatomy you can differentiate on the CT image. And the last part of the CT objectives is to be able to understand, distinguish between normal and abnormal appearances, specifically of the head and neck.
So the rationale for undertaking this unit is to assist you when you look at images and to be able to make informed opinions. But be aware that mistakes are often made not by not knowing, but actually by not seeing. You are not specialist radiologists who regularly look at these images, and although radiologists, it's part of their daily duty, they still make mistakes. So it's important to have an alternative pair of eyes to look at the images. So the expectation for this unit is not for you to make the final diagnosis. The final diagnosis still rests with the radiologist. There is a difference between a descriptive and a medical report. With the descriptive report, the main objective is to find out whether there is an abnormality or is this case normal. If you do see an abnormality, where is it? And then to be able to describe the features that you are seeing. However, in comparison with the medical or diagnostic report, that report will indicate the most likely diagnosis and also to consider other possible causes for the appearances on the image. So here is an example of a descriptive or technical report. So when you look at the chest X-ray, the main question is, do you see an abnormality? And clearly there is something. And then where is it? It's in the right upper lung. And then what are some of the key features? So if you look carefully at the image, you can see there's cavitation, there's also a fluid level, and then the wall thickness around that appears to be less than 5 millimeter. When you compare the right lung to the left lung, you'll be able to see there's a loss of lung volume on the right. However, in comparison, the medical diagnostic report will report that there is a lung abscess secondary to infection, but will also consider whether there could be other causes for this appearance. For example, it could be tuberculosis or maybe a primary carcinoma. It is important to be aware that it is normal to be unsure when you look at images. So if you look at an image and you are unsure, it's okay to say that you don't know or that you are unsure, because the images in front of you might not even give you the answer. So it's better to be unsure than to provide a misleading or inaccurate opinion. There are a number of diagnostic algorithms when you try and identify the pathology. Firstly, with the clinical findings, the symptoms that the patient appeared with, and also other tests that can be involved, for example, blood tests. And with plain radiographs might not provide the definitive answer, and there might be the need for additional imaging tests, so additional other diagnostic tests such as a CT or MRI or ultrasound. And then it's important to consider time. Sometimes it's useful to wait for a couple of days and re-x-ray the patient, but also don't forget previous films as well. So if the patient had previous x-rays, it's important to correlate whether the changes that you are seeing now has been visible on the previous images. There are a number of resources available to you, and the first point where you should start at is the unit guide. The unit guide will have a lot of information, so familiarize yourself with it. It has the unit objectives, it's how the material will be delivered, as well as the assessments. Then on the RAD5201 Moodle site, there will be a weekly timetable. The material is delivered on a week-by-week basis so that your learning can be scaffolded. You will also have access to an e-resource, which is the Advanced Medical Imaging and Clinical Skills Image Interpretation Manual, which will be available on Moodle. We'll have video recorded presentations, and then there will be a number of library resources which will include ebooks, and I've provided the reading list link to you. So in terms of the ebooks, you can see there will be 6 books that you will be able to access as an ebook, so you don't need to actually go to the library, and we will direct you to the pages for each of the weekly activities in these books. In total, there will be 5 tasks. Task 1 is an online exam, which will focus on the psychophysics of vision, and that will be a Moodle quiz with short answer scenario-based question as well. And the duration of that will be 30 minutes. The weighting for that is 15%, and it will take place during week 4. Task 2 is an online exam. The focus of that will be on the normal radiographic appearances, and that test will be 45 minutes long with a weighting of 20%, and that will take place in week 9. Task 3 will be an online exam, and that is on the abnormal radiographic appearances of the plain radiographs, and that weighting is 20%, and this will take place in week 1 of the formal university exam period.
Task 4 is an online examination looking at CT image interpretation. This is worth 20%, and it will be during week 2 of the examination period.
Task 5 will be the final submission, which is a medical imaging portfolio. The weighting for that is 25%, and the deadline for that submission is Friday the 22nd of November at 11:55 p.m. and I will have an additional presentation on the medical imaging portfolio to work you through those requirements. Please remember that all assessments are hurdle requirements, so it means that you need to pass those assessments at a minimum of 50%. However, if you fail the first time, you will have an additional opportunity to undertake a second assessment, but that will be capped at 50%. Now for task 1, which will focus on psychophysics, there's the online assessment, and this will be a mixture of multiple choice questions as well as short answer scenario questions. The resources to prepare you for this test will come from the Advanced Medical Imaging Manual, and those are the first couple of pages, which is from page 7 to 34, and then also the video recorded lectures, of which there are 3 of those. It will be a computer-based exam which will be accessed via the Moodle platform assessment taskbar. Task 2 is the online exam on the normal radiographic appearances, and as mentioned, it will have an overall weighting of 20%. The material that will be covered will be during weeks 2, 5 and 7, and I've listed the resources that will be useful in preparing for this exam, and again the exam will be accessed via the Moodle platform. Task 3 will focus on the abnormal radiographic appearances on the plain X-rays, and this will be covered during weeks 3, 4, 6 and 8. And again, there's a list of all the resources as well, and then similar again, this will be accessed via the Moodle platform.
Task 4 will cover the key topics of CT, covering materials from week 9 to 12. So this will include the key basis of how CT images are produced and how they impact image interpretation, and also the normal and abnormal appearances of CT images of the head and neck. We've got some key resources here, and again, it's a computer-based assessment on the Moodle platform.
Task 5 is the submission of the medical imaging portfolio with a weighting of 25%. You need to include 25 case reports, which should cover a range of body regions. For example, for the plain radiographs, that should include the limbs, the chest, the spine, the cervical spine, and then also to include a range of both normal and abnormal findings. You can also include a maximum of 5 CT cases, which would make up, be included within the 25 cases. And then for the each case, the word length is 60, and it includes then a total of 1,500 words for the portfolio. In addition, a preliminary image evaluation assessment needs to be completed. So all the case reports that you've included, those 25 cases, you need to use that to calculate your sensitivity, specificity and accuracy. And I will provide more information about that. And as mentioned, the deadline for that is Friday, the 22nd of November at 11:55 p.m.
So being successful in this unit, we encourage you to regularly engage with the self-directed material, with the Moodle books to help you keep on track. And throughout, we have paced formative assessments for you to help test your knowledge as you're going through the program.
So we would like to encourage you to stay in contact with us. We are here to assist you, and we trust that you will enjoy and get a lot out of this unit. And I would just encourage you further to study hard to be successful, so that you can meet the objectives and the reason why you've actually signed up to do this elective. Thank you.